Welcome to Emend Healthcare. In a residential recovery setting, the body requires specific nutrients to repair the brain and stabilize the nervous system. That is why we treat nutrition as a core component of every client's recovery plan. This training provides the exact steps required to screen new arrivals, calculate their risk level, and initiate the correct clinical response. Every client must receive a nutritional assessment in the EMR at the time of admission. This is a universal requirement for every individual entering our care, regardless of their history or appearance. By establishing this baseline for everyone, we remove the need for guesswork and ensure that physical health risks are identified on the client's first day in the facility. The assessment in the EMR is structured as a checklist covering 9 specific domains of health and behavior. You will start by evaluating physical indicators. Ask the client about unintentional weight loss of 10 pounds or more, dental pain that interferes with eating, known food allergies, and any recent changes in appetite. Next, you'll look for medical and behavioral markers, including chronic GI issues, uncontrolled blood sugar levels, self-restricted food groups, non-compliance with medical diets, and observable signs of an active eating disorder. Throughout this process, maintain a clear clinical boundary, recognize risk, and refer it to the team. You are recording objective observations, not diagnosing a medical condition. If you observe a client hiding food or rushing to the restroom, report those specific behaviors. Do not confront, interrogate, or accuse the client of having an eating disorder. Relying on objective reporting rather than confrontation protects the therapeutic relationship. This approach allows the healthcare provider and clinical director to manage the medical evaluation safely. Based on your entries, the EMR generates a numerical score that places the client into one of 3 risk tiers, each with its own set of mandatory actions. A score of 0 to 8 is low risk. At this level, you provide standard dietary services and continue to monitor the client for any significant changes in weight or appetite. A score of 9 to 12 indicates moderate risk. This requires you to provide dietary education, update the treatment plan with nutritional goals, and ensure a clinical reassessment happens within 30 days. If the score is 13 or higher, the client is high risk. This triggers an immediate referral for a consultation with a registered dietitian. For high-risk scores, you must also notify the clinical director and the healthcare provider. They will determine if medical tests or direct dietary supervision are required. Following the calculated score ensures that a clinical response begins as soon as a high-risk profile is identified, without the delay of subjective debate. For moderate or high-risk scores, you must satisfy a documentation standard known as the shift note rule. Your shift note must serve as a legal record of communication. It must include 4 pieces of data: the name of the staff member you notified, their professional role, the date and time of the contact, and the method used, such as a phone call or in-person report. These findings also move beyond the shift note and into the client's treatment plan. Here, the team adds measurable goals, such as maintaining weight within a 5% range or demonstrating compliance with a diabetic diet. A clear shift note is the proof that the process was followed. Proper documentation protects the client's health and provides a clear record of your adherence to facility protocols. Consider a scenario where a new arrival reports chronic nausea and visible tooth enamel erosion. The EMR generates a high-risk score of 14. You immediately contact the clinical director and the healthcare provider to report the score. You then document those calls in your shift note, including the names, times, and specific roles of the people you spoke with. In another situation, you might see a client with type 2 diabetes eating high-sugar snacks. In this case, you would document this as diet noncompliance rather than a behavioral infraction. You update the provider for medical orders, explore the client's reasons for noncompliance, and work with the team to update the treatment plan with new educational goals. When you apply these clinical protocols with a calm, supportive tone, you provide the client with consistent care while meeting all regulatory standards. To recap the workflow, assess every client during admission. Follow the action tier dictated by the EMR score, and log every notification in your shift note. Remember your professional boundary. Recognize signs of nutritional risk and refer them to the clinical team, but do not diagnose the client yourself. Completing this assessment correctly provides the clinical foundation for client safety and support. By monitoring these 9 domains, you ensure that every person at Emend Healthcare has the nutritional resources they need for a successful recovery.